Patients who deal with chronic health conditions can often fall through the cracks of our healthcare system and end up living in poor health conditions and ultimately costing the system a lot of money without getting many results.
MTN's Augusta McDonald shows us a new alternative model of care that's proving to help patients get the assistance they need.
Partnership Health Center's Super Utilizer program serves a certain type of patient. They typically lack the skills and resources necessary to deal with their chronic health needs and often end up in the emergency room on a regular basis. Over the past year and a half, 2 case managers at Partnership have been tasked with spending time with these patients in their homes in order to figure out why their health outcomes are not improving and what they can do to make them better.
They're affectionately known as Chaz and Ted. And this is Susan. Due to a car wreck 2 years ago, she's mainly homebound now and in need of surgery.
How has your life changed since then?
Drastically. It ruined my life. I have no social life.
In spite of their patients' complicated conditions, Chaz and Ted say they're resilient.
Between now and when we get the surgery, we have to make sure that Susan is living the best life that she can right now, and that means that making sure that she has the necessary supplies to so that she can go out in public, so that she can
make her bingo night.
Yeah.
Right.
Yeah. Tonight's bingo night.
Tonight's bingo night.
This level of engagement, it requires something from the patient, and when you've got a chronic condition, oftentimes you don't have more to give. And that's where ideally we get to step in and say, hey, how can we help you out? What have we been missing?
The program gets referrals through a couple different routes, and the patients have to fit an inclusion criteria. That umbrella covers patients who typically live with at least one of the big 5 conditions, as they call them: congestive heart failure, COPD, diabetes, asthma, and high blood pressure.
What I've seen a lot of is patients becoming fatigued for caring for themselves. It's like a self-care compassion fatigue, where they're just no longer really have the willpower to check their diabetes every day, or to make sure their blood pressure is staying down, or to make sure their salt intake is as low as it can. Do that every day for 30 years and you're going to get tired of it.
Every case is different. Their latest results are showing that by reducing emergency room visits, their efforts are saving money and also improving the patient's quality of life.
It's those sort of tangible successes where we're actually changing the day-to-day experience in patients' lives by getting the healthcare crises out of the way so they can sort of live life again.
They work with about 20 to 30 patients at a given time. Their grant money with the Montana Healthcare Foundation that's paying for Chaz and Ted to do this work lasts for about another year. After that, Dr. Stanger told me they hope that their positive outcomes can be used to convince payers like Medicaid that this upfront investment in coordinating patient care is worth it. Augusta McDonald, MTN News, Missoula.